Welcome back, everybody. We are starting at something new here on the forum. We are calling it Wellness Wednesday. It's basically where we talk about health-related topics and give you access to experts in the field. Today we are going live on Google Plus with Dr. Devang Desai, Chief of Interventional Cardiology at St. Mary's. Did I say that right? Today we're discussing the signs and symptoms of heart disease. First of all, thank you so much for being with us. I really appreciate it. Let's go ahead and start off with
Thank you for having me.
Absolutely. Let's start with the first basic question. Who really is at risk for developing heart disease?
That's a great question. You know, honestly, anybody is at risk for heart disease. What we standard do is risk stratify based on risk factors. So patients who have multiple risk factors, which are including but not limited to diabetes, hypertension, bad cholesterol, smoking, bad family history. Those things are what usually will do it.
Okay, we have a question here on Facebook that we want to ask you about. It says here, one of our viewers wrote in and said, I'm a type 1 diabetic, 29 years old, or 29 years. I'm age 39. I've had no complications thus far. However, I get chest pain out of nowhere that can last for several minutes. I have put off going to the ER thinking nothing will be found and I will be sent on my way. There are tests available, or are there tests available out there to go in and be checked even if I don't have anything going on basically at that point? And is there anything I can do to find out what's wrong?
Yeah, there's absolutely tests available. This patient is at high risk being a diabetic for long term. I think what you should do is seek medical advice, but I think a stress test would be the best test for her.
Lastly, quickly, what are some recommendations for reducing someone's heart risk?
I think the biggest thing you can do is reduce your risk factors, control your diabetes, hypertension, cholesterol, and if you're a smoker, stop right away, diet and exercise.
Dr. Desai, thank you so much for everything. We're going to be doing this again every Wednesday. If you've got questions, let us know. We'd love to have you in and have you ask those questions yourself. By the way, we're going to be hosting these topics on Monday, so if you'd like to join in then, you can as well, and let us know. We'll pass along anything you might have to the good doctors. Thanks so much again. I appreciate it. All right, coming up next, we have got your viral video. Stay with us, The Forum. We'll be right back.